it is. Let me just show you on this, kind of where this is, and then I'll show you back on your CAT scan. So here's your teeth, here's your tongue. You know, this is your larynx, your voice box. So there are two parts of the tongue. There's the oral tongue, which is part of the mouth. So that's oral cavity. If there's cancer here, that's mouth cancer. You know, these things here, this little V, this is the circumvallate papilla. This here separates the oral tongue from the base of the tongue. The base of the tongue is in the throat. So this thing is living right here in the base of the tongue.
I'm pressing out here.
Yep, and there's a lymph node out here. You know, this little guy here is the lymph node. That's where it has spread to, okay? But it looks like it probably started here. Sometimes these tumors will kind of grow into the throat where they look like they're into the airway, where they're obvious, oh yeah, there's a big old tumor. But in your case, it kind of grew down into the tongue as opposed to up into the open part of the throat. Does that make sense?
That's why I couldn't see it when they went in for the...
Yeah, that's why when I looked, I'm like, yeah, it looks a little swollen, a little asymmetric. I wouldn't mind looking again if you don't mind letting me look. I'm not going to charge you, obviously, for it, but I wouldn't mind looking again now that I've seen your scan. It might make a little more sense. Would you mind if I took
No, not at all.
a quick look? Okay, let me just do that, and then I'll go back and show you your scan.
And so, well, what you were saying here is that this is the area, and then the gland is over here.
Correct. Yeah, so the gland, and this is drawn here. See that? That's the salivary gland. The mass is just on the other side of that, kind of right there. You know what I mean? Just spray you down here. I don't remember this being as prominent when you first came in. This feels like it's bigger.
It's bigger now, yeah.
It is bigger.
It's bigger, right?
I called.
Yeah, it was out a little bit.
Because when I called Dr. Mazzella, the radiologist, I'm like, I don't remember him having a palpable neck mass. I remember seeing the thing in the base of his tongue.
Well, I know that we had told Dr. Dewey, you know, about some...
The discomfort in the throat.
Yeah.
Yeah.
And then when he came and talked to you, he was, you know...
You
You
were
said
thinking
something
that
about his weight loss and the carotid arteries here,
Yeah.
and you thought maybe it had something to do with just the weight loss.
Yeah. No, I can feel it. I feel much more